Have you ever wondered how a tiny pill swallowed into your stomach knows exactly how to slow down your racing heart, open up your tight lungs, or erase a severe migraine? It all comes down to cellular communication and specifically the four major families of drug receptors. Think of your cell membrane as a highly secure building. For a drug to deliver its message inside, it needs to interact with a specific type of receiver. Pharmacologists classify these receivers into four distinct groups based on how they look and how fast they work. Let's look at a simple overview to see these families side by side. The first family is ion channel receptors, also known as ligand gated ion channels. Think of these like an ultra fast electronic turnstile. When a drug molecule binds to the outside of this receptor, it instantly forces a central gate to pop open, allowing specific ions like sodium, calcium, or chloride to rush into the cell. Because this is a direct physical opening, it is the fastest mechanism in the body, taking place in mere milliseconds. A classic example is the nicotinic acetylcholine receptor found at the neuromuscular junction, which muscle relaxants like suxamethonium target. Another high-yield example is GABA receptor, which acts as an inhibitory gate when drugs like diazepam bind to it. Chloride rushes in, instantly calming down brain activity to stop a seizure. The second and the largest family is G protein coupled receptors, often abbreviated as GPCRs. Because their protein chain weaves back and forth across the cell membrane exactly 7 times, we also call them serpentine receptors. Think of a GPCR like a security guard standing at a door who has to pass a physical note to a manager inside, who then turns on a machine. When a drug binds to a GPCR, it triggers a cascade inside the cell involving a middleman called a G protein, which then activates second messengers like cyclic AMP. Because of this multi step signaling relay, GPCRs take a few seconds to work. This family is divided into three main subtypes that you must know for exams: GS, GI, and GQ. GS stimulates the cell like when adrenaline binds to beta 1 receptors to speed up your heart. GI inhibits the cell like when opioids bind to mu receptors to blunt pain signaling. GQ activates a different pathway entirely, like when noradrenaline binds to alpha 1 receptors to violently constrict blood vessels and raise blood pressure. The third family is enzyme link receptors or kinase link receptors. Think of these like a dual key ignition system on a machine. These receptors span across the membrane, and when a drug binds to the outside portion, it directly activates an enzyme catalytic site on the inside portion. This activation usually triggers a chain reaction of adding phosphate groups to proteins, a process called phosphorylation. Because protein synthesis and structural modifications take time, these receptors operate on a scale of minutes to hours. The absolute classic must-know example here is the insulin receptor, which acts via tyrosine kinase to unlock glucose transport channels into cells. Another great example is the receptor for growth hormone, which directly drives tissue repair and cellular replication. The fourth and final family is completely different from the others: nuclear receptors, also known as intracellular receptors. While the first three families sit right on the cell membrane looking out at the extracellular fluid, nuclear receptors are hidden deep inside the cytoplasm or directly on the DNA within the nucleus. To reach them, a drug must be highly fat soluble to dissolve straight through the lipid bilayer of the cell membrane. Once inside, the drug binds its receptors, and the entire complex hitches a ride onto the DNA to directly alter gene transcription, telling the cell to manufacture entirely new proteins. Because you are physically building new proteins from scratch, these take hours or even days to show a clinical effect. Classic examples include thyroid hormone, vitamin D, and all steroid medications like hydrocortisone or dexamethasone. This long delay explains why a steroid inhaler does not stop an acute asthma attack instantly, but instead prevents attacks over days of consistent use. To wrap it up cleanly for a quick review, ion channels are direct gates working in milliseconds, like the GABA A receptor. GPCRs are 7 transmembrane serpentine relays working in seconds, like beta blockers or opioids. Enzyme linked receptors act as internal switches working in minutes, like insulin. And nuclear receptors are lipid soluble DNA modifiers working over hours or days, like corticosteroids. Master these four basic pathways, and you understand exactly how medicines change cellular behavior. If you liked the video, subscribe to my channel, and I will see you in the next one. Thank you.